High-level review meeting is underway as the monkeypox scare is now sent alarm bells, at least as far as certain states and the national capital is concerned, because a fourth case of monkeypox has now been reported in the country, the first one here in the national capital. The Directorate General of Health Services is in a huddle as we speak. This after a 34-year-old male resident of Delhi was isolated at the Lok Nayak Hospital of a suspected case of monkeypox. The patient is presently recovering at the designated isolation center. Close contacts are also being identified and traced and are going to be put under quarantine as per the new guidelines that have come to the fore. Akanksha is live with me for more on this. Akanksha, that meeting is currently underway, but what is alarming about this particular case that has come to the fore from the national capital is that this patient had no history of foreign travel. He also got himself tested about a month ago. Since then, we do not know how many people he has come in contact with and how many people he could have passed it on to.
Well, absolutely, and contact tracing is in fact underway. This 34-year-old man has in fact tested positive for the monkeypox in the national capital. With this, the number of cases in Delhi across the country has climbed to 4. Few days ago, there were 3 cases reported from Kerala. But today, after this case came up in Delhi, Health Ministry has now sprung into action. A high-level meeting, review meeting, in fact, is currently underway at Directorate General of Health Services. If we talk a little about this man who has now tested positive, he's 30-year-old, belongs to West Delhi, has no history of foreign travel and had developed these symptoms a month ago. From all we know, he had gone to Himachal Pradesh to attend a party, after which he came here and was admitted in a Delhi hospital 3 days ago.
Right.
His samples were also sent to National Institute of Virology, after which they came positive. So, in fact, this is the first case in the national capital
and the fourth one in the country, and which is why the centre is now taking stock. Stay on with me. Chairman of Nephron, Dr. Sanjeev Bagai, is with us on the broadcast. Thank you so much for speaking with us, Dr. Bagai. The fourth case coming to the fore in the country, the first one in the national capital. But what's perhaps alarming is the fact that for one whole month it went undetected. He also has no history of foreign travel.
Yeah, so good afternoon. Couple of important points. So there are initially, before this outbreak, there were very few cases worldwide. So I think entirely the world has much to learn still. There are more than 16,000 cases in more than 74 countries now. The mode of transmission is multiple. So foreign travel is not necessary to predispose a person to make him susceptible. This is airborne both through droplets and through microaerosol and through contaminated surfaces, what we call as fomites. There is a large study which has been done in UK which has proven more than 75% of cases are airborne or through contaminated surfaces. So like bed linen or tabletops and things. Plus the incubation period can be up to 21 days. So he may have come in contact with someone more than 3 weeks back and manifested now. But I think we need a high index of suspicion. There is no need to panic. A high index of suspicion. The real carry-home message is any fever which is high grade, you have headache, extreme fatigue, and rash with or without pustules, please inform the local health authorities and isolate yourself immediately. This is contagious. It can also travel through a sexually transmitted route, and it can also go from person to person as direct contact. So isolate yourself and seek medical attention.
Dr. Bagai, the fact that you're saying that this is not just spreading via touch, but also the susceptibility of monkeypox virus can happen via aerosol suspensions as well. Is it something that can spiral into as big a crisis as COVID did?
It's difficult to say right now, but we know that the way the mutations took place in SARS-CoV-2 have been unforeseen, and it is still mutating as we speak. So I don't anticipate that because this is a DNA virus. There are 2 pockets. One is in Central Africa near the Congo Bay, and the second in Western Africa, which actually were the hub in early 1980s. But at the present moment, I don't think there is any need to panic. The message really is isolate yourself if you have symptoms, but please do not self-treat and wear a mask in close, crowded places, especially to protect yourself and your near and dear ones.
Right, Dr. Bagai, I just have one last question before I let you go. Now, the WHO yesterday declared this as a global emergency. What really does that mean? Does that mean there just should be, greater monitoring and we should be wary of this particular virus from spreading, or is there more to that?
I think there are three carry-home messages with this WHO announcement. One is that we need a very strong public messaging to make public sensitized and to tell them what the do's and don'ts are. Second is high level of surveillance. I think the medical doctor fraternity themselves have to be sensitized to what is to be done and what is to be done in terms of diagnosis and treatment. And three is we need to re-emphasize masking, at least in public spaces, isolation, testing. There are two vaccines which are available, especially in US and certain other Western countries. But I don't think we need to go down the vaccine path just yet. We just need to contain it at the present moment.
Right, Dr. Bagai, thank you so much for speaking with us here on Times Now. My colleague Akanksha continues to be with us as she's getting us details of the measures that are being put in place both at the central level and at the state level. Now, Akanksha, the first case had come to the fore from Kerala, and immediately the Central Health Ministry had dispatched a high-level team there to monitor, to study the case, and then guidelines were issued. Now that 4 cases have come to the fore and a meeting is underway as we speak, are we expecting revised protocols, at least as far as foreign travelers are concerned?
Well, as you rightly pointed out, when the first case was reported in Kerala, a central team was rushed there, and now that 4 cases have been reported all across the country. A high-level meeting is currently underway, and in fact, the guidelines have also been issued by the Health Ministry regarding
Right, sorry
this.
to interrupt you there. We're just cutting across to a media briefing that the BJP is